Okay, I'm going to go ahead and get started. Good morning, everybody. Thank you so much for joining us at the Chicagoland Healthcare Workforce Collaborative's Inclusive Talent Acquisition Industry Convening. I'm April Harrington. I'm the project manager for CHWC. As a reminder, before we get started, the mission of CHWC is to unite employers and industry partners to support an inclusive healthcare workforce, provide accessibility for unemployed and underemployed populations, and develop innovative responses to the evolving needs of the healthcare industry. We follow a sector partnership model, which means that our employer partners are the leaders at the center table. We have about 12 major Chicagoland hospital systems at our table, and then more than a dozen strategic partners support our work. This is one of 3 industry convenings that took place last week and this week. The goals of these events were first to allow our employer partners to share their unique strategies and programs that they're implementing in their own systems with each other, to learn from each other's opportunities and challenges and successes. And then also to have a discussion around shared challenges, shared opportunities that hopefully will lead to some opportunities to collaborate through CHWC. We've already completed 2 of these events. Last week, we had our Youth Pathways and Career Awareness convening. And through that, we came up with a couple solid ideas to create a directory of all of our youth pathway programs that faces youth so they are more aware of their opportunities, and also to plan a large event to bring together all of the youth that participate across the systems for a one-day opportunity to network and have some job readiness curriculum, find out about more opportunities. And then we also had our adult and incumbent worker pathways conversation on Tuesday, which was robust and led to a lot of initial ideas or thoughts on things that we could do together that we'll continue to think about and talk about and figure out how can CHWC support this work. I also want to let you know that our next quarterly meeting is on September 14th at 8:30 a.m. At that meeting, I will present some high-level takeaways from all of these events and introduce the ideas for programs through CHWC and figure out a way forward. So I hope you all can join us there as well. So we have a shorter agenda for today. Unfortunately, one of our presenters had to drop out at the last minute, Northwestern, but we will hear from both University of Illinois Health and Rush University Medical Center. So both of you can feel free to take your time. We also have lots of time for questions. I'm sure everyone will be very interested to hear about your strategies. And then we will open up the floor for discussion. I like us to talk about what our shared challenges are in talent acquisition from an inclusive talent acquisition strategy. So from underemployed populations, specific targeted populations, local populations. And then we can talk about how can we collaborate? How can we work together to address these challenges? And hopefully come up with some ideas for some things that CHWC can do and provide funding for. So without further ado, I think I'll turn it over to University of Illinois, Kinga. Oops, I need to make you co-host. Now you.
April. If I may, I'm actually on another meeting. We have a closure today in the hospital. So if you could like put me a little bit on hold,
sure.
I would
Dana,
really appreciate it.
No
Thank
problem. You. Dana, would you be able to jump in from with Rush?
Sure. Good morning, everyone. So I guess if you grant me.
Yep, you should now be able to share your screen. Thank you, Dana.
No problem. Okay, give me 1 second. Okay. Can everybody see my screen?
Yes, you can see your screen.
Okay. Okay, so good morning, everyone. As April mentioned, my name is Dana Anthony. I'm the community sourcing consultant with Rush University Medical Center. I am located at our Rumsey, as we call it, location. We have several different locations throughout the Chicagoland area, and so I am in the medical district. So Rush is a place of healing. We have our eye care values, excuse me. And so it's innovation, asking questions that challenge the status quo, testing new ideas, and being willing to take risks to achieve our vision. We have collaboration, partnering with others to leverage the strength of each, engaging in honest conversations that make the team better. We have accountability, taking ownership and keeping commitments, speaking and encouraging others to speak up. We have respect, using appropriate strategies and solutions for dealing with or diffusing workplace differences, acknowledging others and expressing gratitude. And then we have excellence, doing everything possible to ensure the best outcomes, keeping patient services at the center of everything that we do. Excuse me, I apologize. I don't know why I have this morning goal. So we are committed to serve as an anchor for the employees and for our West Side communities. And I'll get a little bit more into our anchor mission for the West Side communities. So again, our mission at Rush is to improve the health of the individuals and diverse communities we serve through the integration of outstanding patient care, education, research, and community partnerships. Our vision, Rush will be the leading academic health system in the region and nationally recognized for transforming healthcare. And then I talked about our eye care values, which are listed again below. Our innovation, collaboration, accountability, respect, and excellence. So our integrated, I apologize. Our strategies include people. So the Rush system will be a destination of choice for healthcare, education, training, career growth, and employment. Reach, we will extend the reach and brand of our Rush across the region through innovation partnerships and highly integrated delivery network. Our community, the Rush system will serve as a catalyst to measurably impact each of our communities and our programs. We will develop centers of distinction that will be highly coordinated across the Rush system. So again, as I mentioned, an overview of our anchor mission strategy. So with our anchor mission, we hire and develop local talent. So we have employment preference initiative and a career ladder development, skills training, mentoring, and coaching. We utilize local labor and capital projects. So if anyone has seen some of the construction that is going on with Rush and how we are building, we have included local labor contract construction companies who are in the anchor mission area to help to build onto the Rush systems. We also buy and source locally. So we have different programs where in our cafeteria, maybe we feature a restaurant from the community and give them an opportunity to, highlight and network and market and grow their business. We invest locally, so we invest in local communities, local businesses, and then we volunteer and support community building. So over on the side, we have our anchor mission zip codes. And so as I mentioned in the previous slide about our preferential initiatives, so these are the zip codes that we work closely to try to find quality candidates and give them an opportunity to obtain employment. So our goal is to reduce the life expectancy gap by 50% by the year 2030. Now, we did a life expectancy assessment, and this is why we invest in those West Side communities. So our life expectancy, what we noticed, as you can see here, there is a huge gap between the West Garfield Park area, from the Loop, Oak Park, and Aurora, anywhere from 11 to a 12-year gap. And that's big. So our anchor mission target communities for the Rush or the Rumsey, it's the near West Side, Lower West Side, West Town, West and South Lawndale, East and West Garfield Park, Austin, and Humboldt Park. And then for our Oak Park Hospital, we have Oak Park, Forest Park, Austin, River, and River Forest. And then for our Copley location, which is located in Aurora, we have the locations that are listed here: Aurora, Bristol, Montgomery, Newark, Oswego, Plano, Sandwich. So it's a long list of areas and communities that get this preferential consideration when we are looking to hire for particular roles at these locations. Now with our local hiring, so I have a caption or a quote from someone who is from our anchor mission. So Rush has always provided excellent healthcare, and now that I'm an employee, I can personally vouch for such services. It's been a pleasure working for Rush and educating my community about insurances, specialty doctors, financial programs, and other vital resources offered to the public. So one thing that we have noticed is, although we are right in the center of the West Side communities, they are not aware of the programs that we offer here at Rush. So we partner with organizations to source local talent, and when appropriate, reverse refer candidates to other partners for employment. We have application hub sessions, and I will talk a little bit more about those in our anchor mission communities. And then we leverage our strategic partnerships to drive job placement with Concordance Healthcare Solutions and Trinal Consulting. So these are some companies that we also help to do sourcing for as well, that help us to meet that anchor mission goal. And so you'll see here, this is the data collected from our Q1 and Q2 of the fiscal year, of just the hires that we have in the anchor mission area. And then more about the application hubs. So our application hub sessions, I facilitate those, and that is where we have an opportunity to help our community partners with their client base that they serve, to talk about the different steps and strategies and the application process, and kind of help them to navigate through that process. And then the goal is to increase hiring from the West Side communities to entry-level positions. So some of the top tier partners that we work with are Skills for Chicagoland Future and for CARA. We partner with both of those closely. And what that partnership looks like, they will refer candidates over to us. If they're anchor mission, they will highlight that they're anchor mission candidates. I then go back to the recruiters, and I kind of keep that communication flowing between the recruiter and through the community partner. So if we have a potential candidate who's applied for one of our high sourcing roles or our entry-level positions, such as food service or our EVS roles, and they fall in the anchor mission, you know, sometimes the candidate may have maybe missed the contact, whether it's by email or by phone. And so I'll reach out to Skills, or I'll reach out to Kara, and I'll let them know that we're trying to get in contact. And so we have a really nice open communication line to help ensure that we get some of those candidates employed. Now, I didn't talk about, and I'll stop sharing. I didn't talk about some of the things that are working for us, and it goes back more so to our partnerships. And so something that has been working since I've been here in this role is our partnerships. I reach out to different community partners, not just CARA and not just Skills for Chicagoland Futures. I also work closely with Westside United Health, which has several different health entities that, you know, we collaborate, and we've done job fairs. And then with the hiring events, I apologize, not with the hiring events, with the application hub sessions. So I've partnered with several different community partners, whether it is South Suburban College, whether it be CARA or YWCA. Now, some of these are agencies that may not necessarily have a brick and mortar location on the West Side, but they do have a footprint. And so their reach does go out that way. And we're able to reach some candidates. And with the application hub session, it has been successful because a lot of times, people are intimidated when they're doing the applications and they're not sure, you have those questions, but you don't have someone that you can kind of refer back to get some clarification. And so what I do as the sourcing consultant, I meet with the recruiter for particular roles and just get insight on what it is that they're looking for when they're looking for viable candidates. I then relay that message back to the potential candidates as we talk about specific roles that they're looking for. So, for example, yesterday I facilitated an application hub session with the roles for logistics. And as I mentioned earlier in our slides, we talked about the partnership with Concordance. And so Concordance is not necessarily healthcare, they do the logistics, but they provide a lot of the materials and supplies that we utilize at Rush. And one thing that I do know, YWCA has a transportation, distribution, and logistics career pathway training. So what way to help bridge that gap and give them some viable candidates than to reach out to a company or an agency that has these trained, ready to go candidates with an employer who has these positions that align closely with what they're looking for. And just giving them kind of some of that insight that they wouldn't have going blindly in to look for the positions themselves. A lot of times they get intimidated. It can be overwhelming. Our systems may not be as simple when it comes to doing our searches for employment opportunities. So helping them to navigate through that, helping them to understand what it is that the recruiter is looking for, and what I'm getting feedback from not only the potential candidates, but also the partners. They are appreciative that I have made myself available to be that resource. So that is something that is working. It is fairly new because it was being implemented, or they were making plans to do the application hub sessions, and then COVID happened. And so we kind of had to put a pause to it. And then there was a transition in position. So Chanel used to have this role, and then I came on board and tried to figure out a way where it would be comfortable for not only myself, but also for the partners that we're working with, because we're still in the middle of another spike, and just making sure that the candidates feel comfortable when they're applying, whether it be in person or virtual. So working those things out. So those are some of the strategies that have been helping with getting some of those candidates. Now, a challenge that I have noticed, and this is, I believe, across the board with our conversations with our partners, our tier partners, top tier partners such as Kara and Skills, it's just kind of dry with the candidates overall. A lot of people are not applying for some of these entry level positions or for the skill level positions at all. We're starting to notice that there is a slight increase in applicants, but over the last couple months, it has been, not a lot of candidates that have been applying for positions that we offer. So once we get over that, then we can hopefully have a little bit more, some more success stories about these quality candidates who are applying through these application hub sessions or through our community partners. And so that's all that I have. If there are any questions.
Thank you so much, Dana.
Hi.
Oh, Go ahead.
This is Alicia. I had a question in regards to the clients. Once they are referred over from the community partners, is the hiring process for these candidates circumvented, or do they just receive that geographic preference?
So it's not just exclusive to those that are in the Anchor Mission. It's for any of the candidates. So for example, Skills will send me a list of maybe 10 candidates. Maybe one or two might fall under our Anchor Mission. I still treat them all the same. I will find out the positions that they've applied for and reach out to the recruiters for those roles and continue with the follow-up process just to get updates and then communicate that back to the partner. So whether they are in the Anchor Mission zip codes or just a regular candidate from the south side of Chicago, the north side or the south suburbs, they still get the same treatment. I do highlight though, if they are Anchor Mission, because those are the ones that we really want to take a closer look at. However, if they aren't qualified, they don't get move through the process just because they are Anchor Mission. I just highlight them to let them know, hey, this is an Anchor Mission candidate. They were referred from Skills or they were referred from whatever organization. Please update me on this candidate. I hope, did that answer the question?
Yes, thank you.
Dana, I'm also really curious about this idea of the application hubs, and I wonder if you'd be able to pull that slide back up, just to share a little bit more of the detail, and also just to clarify my understanding, is it more of a session or an event, kind of a time-bound opportunity where you are targeting certain communities and going out, or is it something that is kind of an ongoing resource? That was something I was curious about.
So it is actually, the application hub session is, how can I explain this? So it's not really an event per se, but I take about an hour, and in my prior communication with the community organization, they may have the clients who are interested in the EVS or our environmental tech positions. So what I will do is specifically discuss how to navigate through our system, through our application system on the internet, and help walk them through that process. So it really is, it's based on the need of that community organization. So I don't just come in and talk about all of our positions that we're looking for. It's a more specific targeted search. So if, for example, South Suburban College, they have a certified medical assistance program. So I know that that is a role that we are in high demand and high need of. So I will solely focus on that role. I wouldn't talk about the food service roles and the certified medical assistance. So it's more so just a conversation and answering questions that the candidates may have, that the community partners may have, and helping them to navigate through that application process. I do not sit and, go line by line on the application with them. It's just more of, a conversation to help them through that process. And is this the slide that you were referring to?
Yes, thank you so much, Dana. That was very helpful.
Mm-hmm. No problem.
Dana, earlier on, when you were talking about your Anchor Mission strategy, you referred to the Employment Preference Initiative, but you also mentioned mentoring and coaching. I wonder if you could speak more to that. I know that you are often recruiting for entry-level positions, and once your Anchor Mission local candidates are hired into those entry-level positions, are you putting them into some sort of programs to advance their skills and move into middle skilled roles?
So that is actually something that we have been talking about, excuse me, and having something like a big brother, big sister, like a mentoring program where we can follow them through their rush journey. From my knowledge of, my short time here, I know that there are some things that have been put in place where they do have the follow-up just to kind of help them to move up that career ladder. Rush is really big on promoting from within. So that is something that we talk to our candidates about, how important it is to get in the door for Rush and to think about some of the different programs that we offer, some of the different career pathways, some of the trainings that we have so that you're able to move through the Rush pipeline. Does that answer the question?
Yeah.
Okay.
Thank you.
You're welcome.
I also have one more, and anyone else can ask Dana final questions too before we move on. But Dana, have you and your team at Rush talked a lot about hiring people with previous criminal records and Rush's policies on that, and how that affects your ability to recruit from your anchor mission communities? Have you made any changes to policies, in recent years, or are you talking about making changes in the future? Just anything you're talking about in terms of hiring people with records.
Sure, that's a great question. And I've had people ask me about, if that is a barrier. One thing about Rush, it's pretty much a case by case. So let me put that out there. We also do not disqualify you because of your background. Most people are disqualified because of their lack of experience or some other issue that may come about during the application and interview process, not necessarily because you have a background. We do hire people with backgrounds. We do not discriminate. I do partner with organizations who work with, as they've been phrased, returning citizens. So that is not something that we frown upon. We, again, it is a case by case. We do have a background. So we also make it very clear to the candidates, do not make sure that you disclose that information, because we are doing a thorough background check. So if you, and sometimes that is something that can eliminate you from moving on to the next round because you are not upfront about having a background, but we don't discriminate because you have one.
Thank you. Does anyone else have questions for Dana about Rush?
Dana, this is Mary Schmidt. I did have one question. Does the system have any issues in working with students that have DACA status?
So again, that is another case by case. I do know that has been a question that has been brought up. And I've kind of brought up that question more so along the lines of sponsorships. And there are certain roles, there is a whole department that works with that. So I don't think that is a discriminatory factor either. Okay, I'm not 100% certain, but from what I've heard in our meetings and our conversations, that's not something that is a barrier for employment. It really depends on the different steps that are needed for them to get their sponsorships in order for them to, and I think it's a lengthy process. So that could be more so what causes some issues on the applicant end.
Great, thank you so much, Dana. Much appreciated. Kinga and Donnie, are you ready to? Excellent, thank you. So Kinga, you have permission to share your screen. Should I also give that to Donnie?
Yeah, you can give it also to Donnie too.
Okay. All right, you both have permission. So whenever you're ready, jump right in.
Awesome. Thank you so much, April. Hi, everyone. Sorry for coming late. I was running into a bit of traffic this morning. But my name is Odanis Sandoval. I'm one of the program coordinators here at UIHealth Volunteer Services. right under Kinga. So I guess we'll be talking a little bit about volunteer services and how we are able to keep our volunteers and help them build and help them succeed in their career paths. We have a lot of volunteers from all over Chicago that we like to say that we like to serve our community, and by serving our community, we like to recruit from neighborhoods that UI Health primarily caters to. So here at Volunteer Services, we're a diverse and dynamic group of over 700 volunteers from all walks of life dedicated to providing exceptional care and service to UI Health patients and family. Our program builds meaningful connections, caring relationships, and positive engagement between volunteers, patients, families, and promotes the importance of a positive and engaged patient experience. We really try to promote this at every level of the volunteer experience, from the initial, inquiry about volunteering to, walking them through the hospital and showing them, this is where you'll be stationed. This is your assignment. We try to make it as a meaningful experience for them as we can. Our values follow the CARE acronym. So compassion. We like to treat we make a point to make sure that we treat our patients and families with kindness and compassion, and strive to better understand and respond to their needs. Accountability. We will hold ourselves accountable as an organization and as individuals to act ethically and responsibly in everything we do, to be excellent stewards of our natural and financial resources, and to be transparent in our actions. We will make every effort to reduce waste in all forms, including waste that impacts human health. Respect. We will act with respect, openness, and honesty in our dealings with patient families and coworkers. We will work collaboratively to promote well-being of the communities we serve and to advance patient care, education, and research. And excellence. We work as a team to leverage best practices and innovation to providing the highest quality care for our patients and families. We will devote ourselves to continuously improve everything we do. And we really try to stress this with our volunteers and people that we bring onto our team. I know King and I, we've had multiple conversations about creating a very familial environment for our volunteers, because that's typically how you get volunteers that are looking to serve their communities and looking to give back, and they do that selflessly. So this is something that we go over right off the bat in our orientation to be sure that our volunteers are here for the right reasons. A little bit about our hiring or our onboarding process. Our application process starts with just submitting an initial application. Once from there, they will be take part in an online orientation. We used to do these orientations in person, but with the pandemic, it's a lot easier to send them, a Zoom recording and have them watch that. From there, they'll take a new orientation quiz to just make sure that they understand all of the components that we have here at UI Health and with volunteer services, and then they'll take an intake form to go along with their health screening as well. Which brings us to the next point, or the next step in the process, which would be a UHS health screening. So our volunteers are at the same, they take the same health screening as our UI Health employees, which also comes at a benefit when we try to advance their career paths or their interests, since they have the same they still have the same health clearance as, let's say, like a nurse in the ICU or a receptionist in oncology. After that, they complete a background check, which again goes along with it's the same background check that our employees have at UIHealth, and then they pick up an ID and uniform. And we really try to stress to our volunteers that to use this as leverage when operating in the hospital, to that they are there to volunteer and to help out in whatever capacities that they are able to and are comfortable with. We have volunteers in almost all of our, almost every department here at UIHealth, both clinical and administrative. So our volunteers are really embedded in our hospital system and surrounding clinics. And we use that as an advantage. Our volunteers go off and seek employment in our hospital. They participate in shadowing if they're looking to get clinical hours. And they also participate in research as well. One of our largest populations for volunteers is our student population. So UIHealth is an academic hospital. So the University of Illinois at Chicago holds a large undergraduate population that we typically see an influx of volunteers every fall from the undergraduate population that are looking to get experience into the hospital. So with that, these volunteers are usually very, engaging. They want to be a part of the hospital network. They want to be able to shadow and see what the healthcare setting is like. And like I had mentioned before, the benefits of this is they have a health clearance to work in the hospital. They have a background check. So if they do decide if they are working in, let's say, the diagnostics department, and a position opens up within their unit, our volunteers are the first ones to be are usually the best candidates for the position, as they've been volunteering there on a continual basis, and they already have their health screening and background check. So it makes the HR process a lot faster and easier on everyone's end. And they receive excellent recommendations and references, both from our department and from the departments that they serve as well. We really try to stress to make a bond with these departments and with our coordinators in the units as well. And they, like I had mentioned, we're really embedded into many different departments here at UIHealth. So they get both clinical and administrative experience as well, which also will help with the employment aspect if they choose to go that route. They really get, experience with customer service, with, addressing patient needs, with seeing how logistics are run. So they really get overarching, a very broad experience when they come here to volunteer at UIHealth. So our qualifications for being a volunteer, at least 16 years of age and older. So we do have a somewhat of a significant high school population as well that comes to volunteer. They usually come to fulfill some sort of service requirement, and then if they go to school locally, they continue to volunteer, and then they build that rapport with our departments and our units, and they end up becoming, a lifelong volunteer, which we love. One of our requirements is to make a commitment of 12 months of service with a minimum of 8 hours each month, or to complete 100 hours of service in 1 year. So we really try to make it, we really try to tailor the experience to each volunteer. If they can only make the 8 hours a month, if they, let's say, like they live far or they are in school and they work, we have a self-scheduling platform where they can schedule themselves at. So we try to be as flexible as possible. We see volunteers, doing the minimum, but we also see volunteers putting in, like 20, 30 hours a week, which is amazing to see. Once they complete their online application, they go through the onboarding process of attending the orientation, completing the quiz. The health screening will include a drug screening and healthcare assessment as well. And then they do complete a criminal background check as well. Some of our departments, some of the clinics that are both, some of the departments that they're involved with at UIHealth. So our main one is greeters and wayfinders. So that's kind of the forefront of the hospital. They are in the lobby, with a smile on their face, greeting our patients and families. And, if they need help with finding a specific department, or they need guidance on, where's the gift shop, where's the cafeteria, where's this unit, how do I get to this place? They work with our concierge and our security team to help facilitate that transition, especially if they're new patients and new families and they're not familiar with UIHealth in general. So many of our volunteers start here. They get to know the ins and outs of the hospital and the surrounding clinics as well. And then from there, they typically venture out into a specific department once they've found their little niche. So inpatient pediatrics, craniofacial center, craniofacial anaplastology, diagnostics and imaging, emergency room, outpatient pediatrics, physical and occupational therapy, pharmacy, oncology, surgical services. We have a program with breastfeeding peer counselors, music therapy. A lot of our volunteers are musically gifted, so they have the opportunity to play live music in the hospital lobby. NICU baby cuddlers. So I think one of the programs that's unique to us is our status in the NICU, the neonatal intensive care unit. Our volunteers actually are able to go in and help premature babies by giving them physical contact for our new mothers that aren't able to provide that physical contact to them. Outpatient pediatrics, and then greeters and wayfinders again. Along with this, we do have professional workshop series for our volunteers as well. They do get, along with the experience in the administrative side, we also have these workshop series that they can attend and learn from, that have a variety of different topics, from resume and interview building, professionalism and networking, entry-level positions. So we like to educate our volunteers on the different entry-level career pathways that they can take, whether it be CNA, farm tech, medical assisting, surgical technicians. The list kind of goes on and on. And then we also have a financial planning workshop as well that they can attend. Some of our trends for the 2020-2021, with the pandemic, it definitely impacted us hard in terms of where we could be inside the hospital physically. At the beginning of February 2020, when the pandemic was starting to hit, we were at a total of 850 volunteers, active volunteers. Back in April, when we were hit with many restrictions, we dropped down to about 280 volunteers. But as of this month, we have a total of 700 volunteers as well. So to be able to go from 800 to about 300 and back to 700 is really remarkable for us. And we love to see that our volunteers are coming back with us and are able to, they do feel comfortable coming and volunteering and helping out, even with the pressure and the fear of the pandemic still going on. So we're very appreciative of our volunteers. Our volunteers come from all over the city, and even outside the city as well. Our top 7 neighborhoods are University Village, Lower West Side, Douglas, Brighton Park, Logan Square, Pilsen, and Tri-Taylor. And this kind of corresponds with the population that UIHealth serves as well. Our volunteers, like I said, come from all different areas of the city and just the Chicagoland area in itself. We have volunteers that come out of state. We have one volunteer that is an airline pilot, and he, Kinga, where does he live? I think he's from, I want to say Tennessee.
Tennessee, I think. Yes, I think you're right. So he's just flying to Chicago O'Hare, and when he has some time, he's coming to the hospital and he's volunteering actually in the ER. He actually got an award. So yep, for the excellent care that he's providing to patients. So he's been nothing but amazing. We actually had a sheriff too at some point. We had a lawyer. So it's just, it's very interesting how, different peoples from different walks of life. And again, sometimes with different disabilities, they're just still so eager to give back and volunteer at UIHealth.
I think that's it for our slides. Does anybody have any questions for us?
Hi, this is Tamar from Upwardly Global. This is so incredible. So our organization supports immigrants and refugees who come to the US who are fully work authorized, but are looking to get back into their professional fields. And I specifically work with healthcare professionals. And I work with a lot of folks who, just need to start getting a toehold into healthcare, understanding the difference between healthcare in the US and the countries they come from. And I'm so excited. I'm hoping that we can talk about referring some folks, because they would love to be part of this program, and it's so exciting to see the various places that, I have doctors with experience in cancer and all sorts of different things. So I would love to figure out a way to get some folks into your program.
Absolutely.
Thanks.
We have doctors. So we have one doctor from Spain. She's been helping out. She's been amazing during pandemic. She's been volunteering. Sometimes we had shifts literally 24/7 when we were providing hoteling for our staff. So just amazing dentists from other countries. And the thing is, with the programs that we have programs all over the clinics and the hospital. So we can, they're kind of tailored to the interest of the volunteers, and they could kind of get that hands-on experience.
Amazing. And if, these are folks that are looking for additional support in their career development, our program is completely free. You can refer them to us. We would love to support them and partner as they, grow back into more professional roles. Wonderful. I would love to reach out and have a meeting.
Let's connect. Absolutely.
Perfect. Thank you.
I'm so glad you're connecting, and I'd be happy to send an email connecting you both after this.
Thank you.
Yeah. Kinga, I wonder if you could speak to how your volunteer program is tied into your talent acquisition strategy. And if you're making any intentional choices about where you recruit your volunteers from, or the kind of exposure you give them once they're in your program, based on your in-demand roles or the types of populations you want to be hiring for your.
So when it comes to recruitment, we are pretty much on all the events at UIC, where it's an involvement fair or an open house. So that's where we have our table and we speak to volunteers. And I think what plays a big part too, I think we have a very robust social media that we pretty much everything that we do daily basis, it's out there. We just appreciate our volunteers, and then people see a lot of different opportunities that we have. We also share, that's our new thing that we just implemented, I think a month ago or 2 months ago, maybe, that we actually, as a part of the workforce development, we actually go through all the postings that we have in our organization, and then we kind of choose the ones that they are like entry positions. So and we share it with our volunteers. We are telling them that they can use as reference. So actually, even this week, I had someone that was applying for one of the positions in the concierge in the hospital. One of our volunteers, when I was rounding on volunteers yesterday, she actually got a job. She's a volunteer of 4 years. She got a position in the ER department as an ER tech. So it's so beautiful to see all those puzzles connecting. And I think what's been so successful about this program, we not only have volunteers volunteering in one program. So we like to start them in the startup program so they can get a hang of what we are all about and how this organization works, how to work with patients. But we also, we talk to them, we ask, I always ask them, what are your career goals? And then we kind of give them little pathways. You're interested in surgery, we have a great program in the surgical services. If you put some time in, they will actually, we work with that department, and they actually allow our volunteers to actually be in the surgical room where the actual operation is happening, the surgery, so they can observe that what's going on over there. When they're interested in medicine, or we have great ER program that there's so much going on in that program. When they're interested in kids, we have outpatient pediatrics, when they can interact with the kids. Inpatient pediatric, but is more advanced, where we work with the child life specialist and NICU baby cuddling, so they can figure out while they're still at school, they can figure out what they really want. Sometimes you can you go to school and you think that, oh, I want to be a surgeon, and yet it turns out that it may not be the path I want to go, or I really love working with kids. So it's so beautiful to see, and especially some students that they have been with me for 4 years, I can see how they were starting and then where they are at right now. It's just so beautiful to see. And I always have my door open to everybody, and they're all welcome to come and talk, and I try to mentor them. So it's so beautiful to see how they grow and they discover what they want to do in life. So, and then we tag along to their talents as well. We ask about their, some people are more inclined into artsy stuff. So we try to kind of guide them towards the program that they would be best at.
Kinga O'Donis, this is Patricia Nabrita from University of Chicago Medicine. I was interested in your slide on the workshops that you offer your volunteers. Can you talk a little bit more about that? Because I think those are really kind of interesting. For example, can you tell us, which are the most popular? Are the workshops required of all of your volunteers? So just a little bit more about that would be interesting.
Yeah, definitely. So we usually, we have been piloting these workshops with our youngest population, so our high school population. We piloted them this past summer with our Champions Youth internship. So in this internship, these students are mostly geared toward healthcare, careers in healthcare. Many of them, like Kinga said, you know, they think of healthcare and they think, oh, you know, nurse or doctor. They don't know that, you know, they could be a surgical tech or a medical assistant, or they could work in an administrative role and they're still in healthcare. I think the most popular one that we got response from was probably the professionalism and networking. That internship really focuses on underrepresented populations in Chicago. So we usually strive to go to recruit from our South Side and West Side high schools. From there, a lot of our students still don't really know what networking is. You know, they don't really know how to. In this workshop, we talk about writing emails, how to answer interview questions, how to tailor a resume to a specific position. So a lot of these things, you know, that I think many of us take for granted sometimes, is not common knowledge to everybody. So really, you know, breaking it down and you know, presenting this sort of concept to our high school students, they really, you know, you see it in I see it when they email us. You know, they no longer just give us like one-line emails. You know, they have a signature now. They have like a greeting. Same thing with like our entry-level career pathways. So our first one talks about entry-level career paths that they can attain in just 2 semesters. And then our part 2 talks about how, you know, in just 2 years, you could get a, you know, a certification, a training, you know, an associate's level degree that'll pay almost as much as a doctor's salary. So that was also eye-opening to them as well. And we had representatives from Malcolm X from Malcolm X the community college here that focuses on the health science, is the health science city college. So they were able to present on their programs and how they would qualify. And then from here, we also have a scholarship as well for our interns. So those that put in the most volunteer hours will actually pay for them to go to, you know, Malcolm X or to some other, you know, training to get these certifications or get this, you know, get them started on this career path. So hopefully that answered your question.
And another thing, if I may add something, what was born from those professional workshop series, actually, what we open our doors in our actually volunteer services to actually high school students, to give them that first entry position experience. So we will have actually some of those high school students that they were a part of Champions program, that they will be actually working in our office as a part-time, having part-time positions, answering the phones, answering emails, giving volunteers uniforms when they come, learning that kind of customer service experience. Because usually what happens when they try to apply for a variety of positions, they tell me, Kinga, you know what? I didn't get it, because everybody wants the experience, but nobody wants to give you that first time experience. So we want to open the doors to the kids and give them that kind of obviously we will train them, and so they can kind of be a little bit more familiar and use it on their in their career later on, and put it on their resumes that they actually had that experience, the office experience, and hopefully help them in the future. So I think that's a beautiful thing that that we are so excited about.
That's really helpful. I mean, just the fact that it opens the door,
Right.
doors for the high school students. I mean, I know adults who could use professionalism and networking skills,
Right.
who have been in their roles for a while. But really, it's a great. These seem to be great workshops that just really kind of open their eyes, open the pathways for them. So really interesting. Thank you.
You're very welcome.
Yes, thank you so much, Kinga and Donnie. I think it's such an interesting program, interesting way to use volunteers to engage community members, have career exposure to healthcare, have a pool of people to call upon when you have open positions. I think it's unique, and so thank you so much for sharing.
You're very welcome.
I'd like to take a step back and open the floor to a larger conversation about inclusive talent acquisition. I've started to take some notes about our sort of shared challenges. I suppose I'll share that with everybody. So first, let's just unpack a little bit more of the challenges that we all face in hiring targeted local communities. I know that Dana talked about there just not being enough people applying for these entry-level positions right now. We're not getting enough candidates, and that sometimes, targeting folks from these anchor mission communities may not be qualified for the available roles. They may lack professional skills, as Kinga and Donnie were talking about, not know how to write a resume or email or network. And of course, there might just be a lack of awareness of these opportunities. What are some other challenges that we all see? And I encourage those of us who are on from other hospitals to join in the conversation as to what you think the challenges are. Or anyone.
I would say, April, I definitely think like how you mentioned, just awareness of these positions and how to go about attaining these positions might be a high level need for these populations. A lot of people know, some people might know about medical assisting, but they don't know how to get there. They don't know where to go, what institutions offer the certification or the training. From there, most people don't know that you need a licensing, or what facilities or institutions hire medical assistants as well.
This is Patricia again. So I'm in talent management at University of Chicago Medicine in our organization. And forgive me if I sound unaware here, but do employees who already occupy the positions that are most needed, do they have the opportunity to go and talk to young people, high schoolers? Do they actually go into the communities themselves to say, hey, I was where you were, I was unsure of this particular type of profession, this is how I got into it, and then do they share their own sort of experience in getting their training and getting their certification? Because I wonder if that kind of would really help align or help make it more meaningful for some of the young people who are unsure of what's out there.
This is Alicia, Cook County Health. I think some of the challenges that we've been noticing, just even with some of our youth internship programs, is just looking at what some of these entry-level job descriptions are. Or if they're not entry level, is this a role that really requires this amount of experience or this certification? And so as we had some of our interns, we had a longer extended internship, about 6 months. And this internship, which is our Trailblazers pathway, is meant to be more of a pipeline to employment. And so when we initially started the program, our goal was to try to come up with a circumventive, for lack of better words, process to get these interns into these roles post internship. And so we were facing some challenges because of our employment plan, with some of the positions being unionized, and then some of the interns not meeting the minimum qualifications for the role. And so that really made us take a step back and look at, okay, this intern served in this role for 6 months and outperformed some of the current staff. And so is some of this, some of these qualifications really necessary on some of these roles? And so it really made us internally look at some system change, not necessarily system change, but maybe some policy changes or changes on, more simply the job descriptions to see, is this something that's needed, or are we creating a barrier and eliminating some candidates that may be qualified and may be great for this role, but they're eliminated because they don't meet, let's say if it requires 3 years of experience, but really you only need 1 month of experience. Or you may only need a certification and no experience because that'll be kind of taught on the job. And so that's where we at with looking at some of our entry-level roles as we think about community pipeline programming.
That's really great to hear, Alicia.
I think that is so helpful to hear. I mean, working with folks who come with international experience, I know they're often, they have trouble meeting some of those requirements and helping employers to see that they have the skills and experience, even if it is in a very different context. And if they look very overqualified because of all the certifications and licensing requirements, how we help them, kind of do a diagonal down pathway to get into healthcare, which so many of them are just want to be in that setting, who are struggling, who are working, driving Uber or working in manufacturing. So it's exciting to hear thinking about really being more clear on those jobs descriptions, what's actually necessary.
So I think that's a universal challenge that I'm finding with some of the candidates. And that's also some things that I've talked to the recruiters about, and some things that I touch on in our application hub sessions to kind of let them know the difference between the required and the preferred. And just understanding, you want to position yourself where you are open to being trained in these areas and not so closed off, because a lot of times, as Alicia alluded to a few moments ago, there may just be really a requirement where you only need a month training, but on the requirement for the job description, it has 3 years. And you're going to go into these jobs and they're going to train you on their systems anyway, but you want to go in with some prior knowledge and with the ability to show that you're open to getting trained to how your system, or how whatever particular company, how their system works.
Is there a way that CHWC could help with this issue? Is there a benefit to your systems talking to each other, perhaps sharing job descriptions, making jobs more standard across our systems so that they're easier to sort of advertise to communities and get in front of people and say, hey, this is a job that's available all across the city? I'm just spitballing here, but if anyone has an idea as to what CHWC can do to help all of your systems with any of these issues, jump in.
I think that a lot of these community-based organizations that may participate within CHWC and Westside United, I think especially as like coming from a recruiting standpoint and a recruiting standpoint, a hiring manager standpoint, soft skills for me, and I think an organization is more important. As Kinga and them talked about, like the professional development opportunities they offer some of their interns, I mean their volunteers. We do the same with our interns, but really preparing because we think about some of our candidates that may be able to, that may have the skills or even the experience. You know, maybe they're applying for a TDL, a logistics employment position, but they don't necessarily have those soft skills. Some of our high turnover roles in our dietary roles, in our food service roles is because of conflict resolution issues. So really training these participants on, you know, professional development, conflict resolution, timeliness, attendance, like some of those skills that they may not get, some of those soft skills that they may not have, right? Because once you're hired on the job, you're gonna learn, you know, some of those hard skills, or you're gonna learn those things that you need to do on a day-to-day. But what organizations do not have the time and a bandwidth to do is talk to a working adult and say, if your child is sick, you need to, and you know the night before, you don't wait to 10 minutes before your shift and say, I can't come in. Or if you're in, you know, get into a confrontation with a coworker, you don't, while you're on the floor, you don't have an argument, you know, in front of patients or, you know, so how do we prepare for those things that necessarily are not taught within some organizations, right? Because this is something that we don't really, we have a learning and development team. That's something that we're not covering, right? We cover some of those things with our with our internships, but not necessarily with our workforce as a whole. But in some of those cases, that's the reason why we get a lot of high turnover because of those things. So I think, you know, maybe as a collaborative, how can, if we have a pool of candidates, how can we work with community-based organizations that, so we're not reinventing the wheel, that offer some of these like employability skills training or professional development training, so that we can get a more qualified pool from the soft skill end. And then I think as we figure out what these roles are, then, you know, that can come as far as like if they need these certifications or trainings, and of course, those revamping job descriptions.
Hi, April. This is Zafar here from University of Chicago. I was just thinking that, okay, whether it would be a possibility. We heard about organizations from, say, from volunteering perspective, as well as from different schools. If it would be possible to, I don't know, like, okay, create an application pool, or like, okay, to have a portal where all the people who have already done the volunteering or are finishing the volunteering or have attended certain programs, if you have those applications in, and the access can be provided to different organizations who would like to participate and pull up applications from that, instead of again contracting and then reaching out. So if there is, and then that would help fast track the process.
I like that.
Yeah, I like that as well, Sophia. Just to add on to your point, maybe some sort of like certification or stamp of approval that might be recognizable for,
Yeah.
let's say like employers from, you know, wherever it comes from, whether it be CHWC or maybe another institution.
And just to take it a little further, like, okay, so once we identified the candidates who are like who volunteered and who've received the certification and endorsement, and if they have interest in, say, MA programs and some other technical programs, how can us as an organization and CHWC can help them get those certifications and get into their career? So connecting those dots of just like, okay, getting them in and helping them learn, get the education required, and then contribute to the community.
anyone have thoughts on this idea of a sort of pool of people who have been engaged with our programs that somehow CHWC is helping to move along pathways, get them into programs, have a centralized place of people who are available for roles? I wonder what Dana or Susan or Alicia.
So something that I, coming from the other side of workforce, these were some things that were being implemented, these job readiness types of trainings where we talked on soft skills and how to conduct yourself in the workplace. There are trainings that are taking place now, whether the client is actually following these once they've received the training is another thing. I do know for me, I try to push that onto the agencies that are doing the career readiness, just trying to stress the importance of having those soft skills, because it does make you more marketable when you're out here applying for these roles. And in some of we do some things called like a blitz interview, where it's a bunch of small mini interviews. And these are some of the questions that I have asked people. How do you handle, I think Alicia was talking about, a confrontation on the floor in front of patients, or just while you're on the clock. How do you handle working with people who may not have the same vision as you, or maybe you all don't get along well? And those are things that I do believe that our community organizations that we're working with, they should have those types of trainings in place, because we don't have the I don't want to say that we don't have the capacity, because we do. It's just we don't really have the time to do those soft skills trainings, because when you're on the floor and you have obtained employment, these are some of the things that you should kind of already know. So just as I stated before, there are organizations that do these job readiness trainings. One thing that I have noticed is some community organizations, they offer them so much that the clients are so tired of these trainings that you don't get them to really participate, because it's like, oh, another job readiness training. I've done 20 million of these and I still don't have a job. Not understanding that maybe they still haven't kind of gotten the idea that they need to still work on those soft skills. But I do think that it is something that should be done on a more regular basis, just so that they can understand. Because if you are open to being trained, then I'm willing to work with you. If you show me that you have those soft skills, if you show me that you know how to conduct yourself in a workplace, it makes for, it makes you more, I don't want to say accessible. It makes you more appealing to me as a candidate, because I know that you know how to conduct yourself. I don't have to worry about, me hiring you, and then 3 weeks later you get into some type of situation and now we have another position that we have to post and source for. So yeah, I do think that some of this should be done. I don't know if this is something necessarily that this platform would have like a certification, or I forgot how you phrased it.
Yeah, endorsement perhaps.
Yes, an endorsement, yes. Because that would take some manpower.
Yeah.
On our side.
As it relates to a centralized system, I think that's an awesome idea. To pull from a pool of candidates, even just to advertise to. I can't think of the name, and I haven't made it to the office yet, but it was a organization, this guy we work with. I know Rush works with them as well. He created like a centralized like a application, a database where social services, agencies, social development agencies, their candidates have like with these trainings, they can put their resume or create an account on this system, on this website, and then employers such as Rush or Health can post their jobs there, and then they can in turn apply. So, but I think that would be a great idea as it relates to filling some of these high turnover, hard to fill roles.
Are you referring to the Chicago Cook Workforce Partnership? Is that who you're
No, it was created by this guy. I can't remember his name. We used to work closely with him before I came to Cook County Health, and then we had conversations with him after. But it was a new startup company. I know Kara used them. I know Rush used them because they were in this little collaborative we had around it. When I get to the office, I can send it to April so she can share with a larger group. But it was not the Cook Workforce Partnership.
Are you talking about Matt? I think that's his name.
Yes.
Yeah.
Yes, I can't remember the name of the.
And now I can't remember the name of it either since I'm thinking about it. But I do know. Yeah. So they they've even gone back and revised their system. Let me look. I'm gonna look because now it's like tip of the tongue. So let me look.
Yeah, I'll be interested to learn more about that and share. We only have about 5 minutes left, so I just want to see if we have any other ideas. We'll explore this idea of a centralized pool of candidates, but anything else that you think CHWC could do, perhaps more on the exposure side. I've thought about, could CHWC do some sort of large marketing campaign on behalf of our entire system to expose people to career opportunities or something like that.
So two things. I figured out who it was, Alicia. It's Rise Kid.
Rise Kid?
It's Matt Rise Kit.
Kit.
So yes.
Sorry, I'm walking through construction, so I didn't hear what was the name.
Oh no, that's okay. Rise Kit. So like the sunrise and a kit, KIT. I think that would be awesome to have a platform because we've been talking about marketing for these roles. I know across the board nursing is something that's really high demand, certified medical assistants. So if you would be able on your platform to reach out to your network to post some of those positions that are out there, because we may not have the same reach. We may, duplicate some of the people that we're touching, but for you and your network reach, you may have a broader and a wider net that you're able to cast out on behalf of us. I think that would be good. So I don't know if you do like a newsletter and then maybe have us submit to you some of our high positions that we're looking for, like our hot jobs, so to speak, maybe submit it to you on a monthly or quarterly basis, however you would send out your marketing to your network. I think that would be a good way to get the word out on the positions that we're looking to fill.
When you say you, who are you referring to?
My apologies, April. I was referring to you, April.
Oh, yeah. I mean, no, don't be. I think that, CHWC's reach is more amongst like all of you, people who work in HR and workforce development, in hospital systems and in the workforce development field. But perhaps we could put, with our access to funding, put funds behind some sort of centralized hub that leverages a bunch of networks, all of your networks. Perhaps you share your own reach as individual systems and get the word out there together about your in-demand jobs.
One other idea that I had that we're starting to pursue at North Shore, starting within the city of Evanston, and then our goal is to expand to Lake County, then the north side of the city, and then the western suburbs, as we kind of hit all of our geographic area where we're located, is partnering with the local school system and we're literally just, we haven't even met with them yet. We're meeting with them next week to begin to think about how can we connect with the students from maybe 4th grade up to help have like career fairs and have them meet physicians, have them meet medical assistants, and see the diversity of jobs that exist within the healthcare industry. And so while it's not going to get immediate positions filled, it starts to create a pipeline of students just being more aware that these healthcare roles exist. And then the other thing we're looking at potentially doing is partnering with Evanston Township High School and working with seniors that are not planning on going to college right away and connecting them to local area schools for a medical assistant pathway program type of thing. You know, CNA opportunities, and what kind of education can we help financially support them with so that then we can track them into a role after they complete that certification program right into North Shore. So it's literally something we've just started talking to the community about, but I'm wondering as a collaborative if we can all come together and think about, do we have a career fair? And maybe we start with students from the city of Chicago, since most of us have locations in Chicago, or do we have an opportunity for students to connect one-on-one with, let's say, a physician that wants to be a mentor for a high school student or a college student who would like to learn more about what it takes to become a doctor or a nurse. So that could be another thing that is less about immediate hiring, but more long-term career pathing.
Thank you, Susan. It's a great idea. We are at time, so I want to be respectful of that. Thank you all so much for joining us. A huge thank you to Dana and to Kinga and Donnie for presenting. They're very impressive programs. I was very happy to learn all about them. And thank you all for participating in this discussion. I think in particular, this centralized pool of candidates is a really interesting idea that we can continue to unpack. I'll be bringing this to our steering committee for more discussion. We'll talk about it at the quarterly meeting in September, and hopefully some of these ideas can take shape into some fundable projects that CHWC can pursue. So thank you all so much again. Have a great rest of your Thursday and Friday and a great weekend. I hope to see you in September. And I'm sure I'll be connecting with all of you individually soon. Have a great day.
Thank you.
Thank you. Bye-bye.
Bye.